Addiction. That's our topic for tonight. What's going on, Secoya Nation? Dr. Schilling bringing you today's wellness wisdom. We're going to spread this out over a bunch of segments because it's just too much information to throw at you at one time, whether we're talking about marijuana or alcohol and things like that. But in recent years, especially, not just past years, I mean, I could talk about kids that I grew up with that were addicted to things, but in recent years, it's been more and more of a challenge, especially with the lockdowns and people being sequestered in their homes and the shelter in place and things like that, and the lack of connection with their friends and family. And then people tend to seek out a way of getting the dopamine that they're looking for as far as how to get the stimulus, because if they're not getting from their social interactions, basically what they're going to get it from is some type of substance. That could be alcohol, marijuana, good night, sex, gambling, dangerous activities. It all comes, those are all drivers of this behavior. So, kids not being able to go to school and see their friends, feeling disconnected from their communities, not having sports, whole seasons being canceled, not being able to get out of their house, they're trapped, and then parents leaning on their substance abuses as far as what their coping mechanisms are. So there's a lot of issues, and this can be a very challenging issue because people are scared. They don't want to talk about it. They feel shame about it. And so I'm going to try my best to unpackage some ideas that are related to the root cause of addiction. Then we'll go into the different addictions later. So thanks to Yvette for providing us this topic. Once again, she's a superstar out there providing inspiration, shall we say. So thank you, Yvette. You're an inspiration to us. So let us know what you want us to talk about. This is great. We love these interactions. We love the opportunity to serve you. We mentioned comment on our people's messages on TikTok and stuff like that. So please keep them coming so we can help you in every way we can. So think of addiction as a root cause, like a basic need to feel love and recognition. Like, who's coming to save me? Who is there for me during my time of suffering? I feel like I'm dying and I need that attention. Now, if you're someone who deals with addiction, please hear me loud and clear. I'm not trying to explain away the challenges you're facing. That's not the point of this. I'm trying to give you a different perspective so you can understand from a neuroemotional standpoint why you might have a tendency to drift towards something, irrespective of whether it's an alcohol, a drug, an activity, or something like that. So just listen and try to take it in rather than judging the information or the messenger. Don't kill the messenger. Okay. So addiction is thought to be an unconscious program of self-destruction. Like it's not something you're thinking about consciously. You're not walking by like, I should just trash my life and I should just, waste away with doing this and that and the other thing. That no one consciously thinks that. It's literally a subconscious driver. That's why we talk about neuroemotional, because it's a neurological phenomenon that manifests itself in the emotional state, and then the emotions are felt in the body, and then we don't like that feeling, so then we take a substance or an activity and numb that. Okay. Typically, we think about addiction being something that's not being said. Okay, so it's something is being shamed, or you don't want to feel shamed because of something, so it's not said. So then that gets suppressed somewhere, and then that creates disturbances in the body. So then the body has to overcome that, or the brain, I should say, wants to overcome that. So then it takes action by seeking out an activity or a substance to help support that. Have a good night, Curtis. Someone with addiction might be subconsciously looking for someone on the outside to take care of them. Someone to make decisions for them. We'll talk about this later. I don't want to, spoil too much thing about the different substances, but they're looking for someone else to reassure them. They're looking for an emotional crutch or an emotional support network, someone else, something else to help them kind of cope with the tough times, because they feel terrible, but they don't know how to ask for that help, and they don't even know maybe necessarily what they need to ask for. It's just an intangible thing. So oftentimes a person who has an addiction, they don't want to feel guilty. They don't want to say, I'm responsible for it. They lay the blame on the addiction. And that's a normal human coping mechanism. I'm sure all of us have done it at some point. We've laid responsibility on something else. But as a root cause, if you want to help someone understand, like, just coach them and say, hey, I know you wouldn't want something to take control over you, correct? And then you get them to, when they say acknowledge, yes, I would not want anything or anyone to have control over me. Then you ask them to say, okay, well, it seems like this substance or this activity has a control over you, whether it's gambling or sex or marijuana or alcohol or cocaine or whatever it is. And then when they're not in the state of being sedated by the substance or the activity, then ask them to engage them in a conversation about how do they want to feel in control of their life? And then work together, because it takes a team, right? I would encourage you not to describe it as a vice. People talk about vices, my vice is my this or that. Typically people who have, again, getting back to the diction, the saying what it is, the diction. So it's addiction is like not saying what is needed to be said. Okay, that's kind of the general, what do you call it? The German New Medicine way of looking at it. It's like a-diction. So you're not saying what you need to say, therefore you sedate that with the substance or the activity. But they typically don't want it to be called a vice, because then it says, then you're attacking them, and you're basically saying like your condition, and they're not focusing on you. It's like somebody walks in a medical office and they say, "How's your diabetes today?" Right? Or how's your what I would tell your marijuana today? It's like labeling them with something other than saying, "Hey, Joey, Bobby, Susie, whatever your name is, how are you feeling today?" Instead of what's your vice? Like how well you've been staying away from the hash, whatever it is, like the coke, whatever it is. That will cause, if you do that with someone talking about it as a vice, you'll tend to have them push you back. Okay, they're going to emotionally put up a wall because they don't feel it's safe, because now they feel like you're labeling them. And just instead of saying that, just try to work with them and say, how do you want to feel? How do you want to live? How do you want to take command of your life and stuff like that? That's going to help create trust and engender a collaborative relationship rather than an adversarial relationship. Okay, so those are just the broad strokes. If you find this stuff interesting, like sign up for our email list, like get on the list. We send out information all the time about this. If you see the Facebook posts, we try to provide stuff on TikTok and stuff like that, because this information is not found in a lot of places. I've looked for it and I don't see it anywhere. Like no one's talking about this stuff. So that's why we feel compelled to bring this message to you, so you feel empowered to understand and make decisions for yourself and support the people you love yourself. So we just encourage you to call us and let us know how we can serve you. Get on the email list. Whatever information we can provide you, let us know. We're here to provide service. We're here to serve the community. If you want to be part of our community, great. If you find this not fulfilling, then great. There's another community for you. But we do know there are people out here that are being served by this, and we appreciate your comments and asking for more help. So with that, we'll sign off for tonight, but we appreciate the opportunity to serve you, and we'll see you tomorrow for the Wellness Wisdom. All right, guys, take care. Bye-bye.